Vodafone cares about you and your health. HealthFest has gone from strength to strength. It gives hope to many Ghanaians across the nation with its free medical assessment and care. The Medical Call Center 255 continues to empower Ghanaians with our unique phone-in medical consultancy. But it all started here on your TV screen with the award-winning program, Healthline. This week on Vodafone Healthline, our doctors talk about anesthetics. In the field, time is running out for Joel, who needs a second operation to save his life.
Hello everyone and welcome to Healthline. On the show, we provide you with healthy home remedies, fitness guides, and general health tips to help you make informed choices for healthy living. As usual, we're here to guide you through the program. My name is Lorraine. I'm here with Ruth,
Papane,
Bright.
Let's step out for Health Camp.
Your friend, Pastor Samuel. The person may say, we are at hospital. Now you operation a juna, Yadimau, and Nomina Odano. Wait me up from I'm ready a juna Moadano.
So, Pastor, what you're referring to, we call in the English anesthesia. Okay, there are several kinds of anesthesia. But what you're specifically referring to, where you sleep, is what we call general anesthesia. To make sure that you, the patient, is protected. So for you not to feel what we're doing if we're cutting you, and for you not to even be aware that something is being done, we give what we call anesthesia, and that's specifically general anesthesia. It's been known in the past that a lot of people go and have surgeries and they never come back. And this has been peddled for so many years. Exactly. It sunk in so well that people actually run away from surgeries. They believe that once they go under the knife, they may never wake up again. And for that reason, a lot of people actually die from the medical conditions that can easily have intervention and resolved, okay?
By and large, anesthesia has developed into a very safe science. So if you need life-saving intervention or life-changing intervention, don't deny yourself because, hey, yes, you need it. Nobody would just put you to sleep for kicks. Once you need to have the surgery, don't be scared. Ghana has developed very well in anesthesia and it's very safe. So I think you don't need to worry. You will wake up.
So, Pastor, there you have it. Anesthesia is generally very safe.
So, Sekani from Abetifi sent this SMS which reads, I have a small lump which I need surgery for. I have been asked to have a lot of tests for it. I think the hospital just wants my money. Why is that?
Osekini, I can understand your worry, but I can assure you the hospital doesn't want your money. The reason doing these tests are important is that, first of all, the hospital wants to ascertain the fact that you are fit for the surgery. So there are a host of investigations that you'd be asked to do. For instance, you'd be asked to do a chest x-ray to make sure that you don't have any chest infection. You'll do what we call an ECG to make sure that you don't have any problems with your heart. Now, some other blood tests you may carry out to be a full blood count to make sure that you have enough blood. They also have to check your liver function, your kidney function, so that you can be sure that as soon as you go through that surgery, you'd be able to recover after the surgery. So all these tests, though they look a lot, they're very important. And it's most important to make sure at least you go into the surgery and come out very safe. And that's the prime objective of every doctor.
Yeah. I think if anything, what they want you to do is that they want you to do these tests. You spend a little money to do these things, so you don't have to spend more money being in the hospital, taking care of yourself after the surgery. Now, one thing we also have to remember is not everybody will go through all of the tests that have been mentioned. So depending on the kind of surgery you'll go through, your pre-operative assessment will include you doing some of these tests. In some other cases, you may not do any tests at all, and you might just have a simple examination.
Many tragedies happen because we have no knowledge of the basic things we ought or ought not to do during medical emergencies. Time for iRead.
Oh! No, I'm not a doctor, but with first aid, I can help. First aid for hypothermia. Move the patient to a warm, dry place. Remove wet clothing and warm the patient by wrapping him or her in a warm blanket, then cover their head to maintain body heat. Lay the patient down and handle him or her as gently as possible and avoid excess activity or movement. Provide warmth to the patient. Hot water bottles may be applied to the patient's neck, armpits, or groin. Give the patient warm drinks and do not give alcohol. Do not use direct heat such as fire or an electric heater. So you see, it's not really rocket science now, is it?
Vodafone, power to you.
Hi, and welcome to another Street Doctor segment. So you have a problem with your heart and the doctor says go do an ECG. What's that all about?
Healthline would like to thank Impact Medical and Diagnostics in Asylum Down for the use of their facilities.
So today we're here with Dr. Martin Eduadade, a cardiologist, to tell us a bit about ECGs. Welcome, sir.
Thank you.
All right. So what exactly is an ECG?
Well, an ECG is basically a recording of the electrical activity of the heart, because the heart is basically a muscular pump. But as it beats, it generates electrical activities, and then it has a specific waveform that we can measure.
So why would somebody want to do an ECG?
A health practitioner may have identified a specific problem that the patient may be having, or may have suspected that the patient has an underlying heart disease. Therefore, you would like to know what the ECG is saying about the person's heart.
So is it a painful process, and should somebody be scared when you're doing an ECG?
Not at all, because the ECG is just picking the electrical activity that is already running around your body. So it is not going to, machine is not going to give you an electric shock or burn or anything of that sort.
So what advice would you give for people who have been told to go do an ECG and are probably afraid to go do it?
Well, I will encourage them to adhere to the doctor's instruction. Probably they have a risk factor, or doctor suspect that there might be some cardiac disease, which the ECG might give us a clue. Patients with risk factors, risk factors like diabetes and are complaining of chest pain, hypertensive, long-standing hypertensive patients should also go for it. People who want to engage into a competitive or want to play football, they shouldn't skip the medicals when they are asked to go for medicals. They shouldn't skip at all. They should do it. It's for their own good.
Doctor, thank you very much. So there you have it. ECGs are not painful. They take about a minute. But if you fall in any of the categories the doctor just recommended, please don't run away from it. Go do an ECG.
Your child deserves a healthy life. You deserve a healthy baby. Join us on Kids Corner as we talk about leg deformities.
So it's something you must know, that some children are actually born with a deformity, and sometimes they may develop the deformity early in childhood. So this could range from the absence of a limb, or a malformed limb, or finding that one limb is longer than the other. These are things that you can notice. So for instance, you can take the hip, and you can have a baby being born with what we call congenital hip dysplasia, in that the child is born with a dislocated hip. Again, you can go to the knee and realize that also the knee can either be dislocated, or you can have what we call knocked knees, the knees cave in, or what we call bow legs, and the knees go out. You go further down to the foot itself, you realize that the child could either have a foot that caves in or caves out. Okay, so these are things we could also observe in children who have limb deformities.
Whenever you are not sure as to whether this is something that you should be alarmed about, something that you should leave to kind of outgrow, or something that would need an intervention, I always say, Why ask so many questions at home when there are people being paid to answer the questions for you? So you can always go to the hospital. We have pediatricians, we have pediatric orthopedic surgeons. So these are doctors that are specialized in bones of children. So they would do the necessary tests and then they would institute the necessary investigations.
Something can be done about it. Most of the time, these people Lorraine spoke about are equipped to carry out operations or surgeries to correct the ones that your child will not naturally grow out of. Okay, some people are born such that their hands are stuck like that, they can't straighten it out. Other people, their legs are probably straight, they can't walk, they can't bend their knee, they can't bend at certain places. There are surgeries that can be done to correct these things. So don't sit down and say that, oh, this child is cursed because wait dear, we haven't seen it before. And then you stigmatize the child, and some people throw away such children. No, there's a lot that can be done for such children. So do get the help they need.
Now, I would like to sound a word of caution to pregnant women. A lot of these limb deformities stem from what you do during your pregnancy. So you need to be careful the medications you're taking. You don't take unprescribed medications. You try and veer away from herbal preparations that you don't know the constituents of. Stay away from alcohol and smoking. It's so important. We can't hammer enough because in the end, your decisions and your mishaps are going to affect your unborn child. This segment is about your common myths and the real stories behind them. We take an SMS and it reads, is it true that when you don't carry your baby at your back, he or she would grow up with weak legs? My sister prefers to carry her baby in a carrier, but my mom won't hear of it. That's an interesting one, if ever I heard one.
Because I assume that this whole culture of carrying the baby at the back is not everywhere. It's common in maybe Ghana and Sub-Saharan Africa. I don't know about, do you know anywhere else that's common with? Not really. So I'm assuming that any other culture that doesn't do that,
would use the carrier.
No, they all have weak knees, isn't it? Because then, I mean, that's what it implies. So you can imagine, really, I don't think there's any truth to this at all. You know, definitely, you can't always have your baby holding like that or by your side. You get tired every now and then. Or sometimes you need to get busy doing something. It's a convenient way to do it, you know. Just put your baby behind, put a cloth around, and you're on your way, okay? And even now, there's some carriers that are made, you can put on like a bag, and then you put the baby in, and then you strap, and then you're off, okay? So it's all a matter of convenience, okay? So if in your case, you can afford a baby carrier, and you put the baby inside, it's still the same old thing. It's for convenience. There's no weak knee about this whole thing. None at all.
So it's a complete myth. There's no truth whatsoever to that one.
The following segment contains material of an adult nature. Viewer discretion is advised.
Sex talk is made easier and more comfortable on this segment. Send us your questions.
And we have a question from one no-named person. It says, I'm a 19-year-old and I've dated my boyfriend for close to 4 months. I think he wants to have sex, but I'm afraid because I'm a virgin. And I hear it's very painful the first time. Please help me.
This is actually a common situation a lot of girls your age find themselves in, where they feel pressured to break their virginity. But I advise that you shouldn't feel pressured to make this decision. It is important to bear in mind the risks associated with this. For instance, you could have sexually transmitted infections such as HIV. There's also the risk of hepatitis B and hepatitis C, and obviously you could get pregnant. But then if you do decide to make this choice, you must make sure that you're fully confident of the decision you're about to make. It's also important to speak to your partner and let him understand your fears. Now, if it gets to a point where you are having the sexual intercourse, it's advised that you have a long foreplay so that you could be better lubricated. But you must know that it's not every girl that has pain during their first sexual intercourse. Some actually don't feel pain at all.
So, in conclusion, what we're trying to tell you is that yes, it could be painful the very first time you have your sexual intercourse, or it could not be. There might be blood. as a result of the tearing of a certain membrane called the hymen. Most of the time we see this membrane is intact in women who have never had sexual intercourse. So you see, people tend to measure whether you've had intercourse or not by the presence of a hymen in the place. Don't be worried about those things. Just keep in mind that these things are possible. You could have pain and you could have bleeding. I would advise that if you really do want to go ahead and have sex, remember to use protection. Also, weigh the pros and cons of the decision you want to make. We're going to leave that to you. You're an adult now. You're able to vote, so you should be able to decide for yourself and make the best decision that suits your life.
Joel has a hole in his heart, which prevents him from living like a normal boy. There's very little his family can do from their small village, Erimon, in the Upper West region.
You're a patient, and you know your mom up away. And be a Joel or Bierana.
Joel has a kind of a congenital heart disease, which we call the tetralogy of Fallot. It's quite one of the complex congenital heart diseases. What it basically means is that he has a hole in the heart, which we call the ventricular septal defect, commonly known as VSD. And then in addition to that, there are some two big blood vessels that come out of the heart. One of them, called the pulmonary artery, is very small. Because of that, enough blood is not going into the lungs for oxygen to get into the blood.
And Sam and Sa 1 year, and Mammy Batuano. So I yom in a basket by me bata. So cha Jojo Makwana, the Ola Nasega school. Alaso can boalo. We are in the one. A Jojo Makwan, Ola Albert or Masontina Credi. Lansuka and Banka ma our while can yelko. So we kaka tewa.
Na doctor ni so nkoye MRI any another X-ray and scan nti ekoye no mu hu se ne we no ne heart no there was a whole double hole in it and na cause that problem we ko ji loan na miniska nti me ko ji loan na omo ye no operation ba ko yes shunt and e bebo ama na ho me yi to mo share ni shan no mo san share se Yanyaska, Yansambra, no more second final operation, a man. Not me nibi. Tomuka say, young fast canning brand about this amount. Let me see, me can just ask away where he. Pacho, the loan back on Amikoji, mean we, and I mean who said the mayor met him at Chia. It mean to me, Koji another one beam. Salary and so because family no so. Mina me hwefie na me tan hwe no ho anso omo nyina nti omo ti kakra ne fi me salary so a mintimi nya bi krompo nkase me kotua half ansa na my we operation na aka me 1 year mama call retirement ti me koji loan na mintimi ntua biem me ni any source so a metimi atua ta loan.
So Joel line dole so ka ulpi anapemana ani dawna za ina ajowe na natao kapo ka balon da na chu da gire saku kapo na tu wata zika chika unun na kwi kan le ka biele kan la doro kapo kuna gwana na Joel so mana puru na se ka Joel oba na ngole na tu ga yitu mana ona na tu ko otuma tuna ma e gon tuma bon.
at the time we saw him about 1.5 years ago. At the time he came, he was very ill because of the heart condition. So we had to do an initial surgery, which we call a BT shunt. And this BT shunt, what it does is that it improves blood flow into the lungs of the patient. So because of what we did about 1.5 years ago, he's now quite active and able to move around very well, and is now well positioned to undergo the major procedure we want to do for him today.
Well, the surgery went well. As we said from the beginning, we plan to close the hole in the heart, which is called a VSD. That has been closed. And we also mentioned that there's a part of the right side of the heart that was narrow, and that was preventing blood from going to the lungs. So that place has been opened up. So at least for now, blood is flowing well through the heart. The hole in heart has been closed. So the surgery only, went very well. We don't anticipate any problem in the intensive care unit. We expect that patient should recover normally. And within 2 to 3 days, we expect the patient to be sent out of the intensive care unit to the ward. And in about a week from today, we expect that patient should go home and lead a normal life.
Abibi nga bani da jowe war ka bawa werona. Impure mambare ya kokuma kanyir. Ani yel diego. Kanta. Che puru kura bala mena war ka bawa tonga batoma. Kana ngwe yu basikie. Che chan ba kai mambare ya via lon chan ba. Ka batunga de abatoma. Kana ngwe abade bandur. Kulia uganda lupo. Che ka batunga batoma. Ka ba yur anye pubu. Ayilinga la kan puru che sorai mambare ya ani adana ani aton maza abayur yang. Amen.
Please help me give a warm welcome to little Joel, Martha, and his mother Patience.
Poor pelle a Joe and poor pelle na Joe. Oh, ear pia and
this is to help Joel in his recovery. Auntie Martha, thank you so much.
I say a very big thank you to Vodafone. Long live Vodafone. God bless Vodafone. God make Vodafone the biggest international network. Everybody should use Vodafone.
Amen.
To raise them more higher.
Amen.
Hey,
Amen.
God bless you.
God bless you.
We are so
too.
grateful.
Thank you. Thank you. I want to see you. Come on, run over.
Zoro, Zoro.
Good boy. Well done. Give me 5. Give me 5.
You are new.
Give me 5.
Well, new.
There you go. Wonderful, wonderful, wonderful. Sit down. Sit down. Good boy. Beautiful things only happen on Healthline, and I'm glad if you share this moment with us. We join you again next week with yet another promising story. Remember that you are the steward of your own health. Goodbye.
Vodafone will continue to support this program. If you have been moved by the stories or issues you've seen on Healthline, you can donate 1 Ghana cedi by texting GIVE to 133. Or you can donate by sending your contribution via Vodafone Cash to 835000. Next week on Vodafone Healthline, our doctors talk about birth control. In the field, we catch up with Nathaniel a year after his life-changing treatment.
Goodbye. Let's go to Mommy.
Vodafone, power to you.